So we talked about relapses, but you also mentioned these smoldering disease or disease progression. And how can I define this disease progression, and how is it measurable?
Yeah, so I kind of when I talk to my patients about this, I call it silent MS, because these are changes that occur over long periods of time that maybe aren't so quite noticeable for the patients until you say, think about how you were 12 months ago. Are you different now? And then patients then eventually, when you ask a few questions, do say, well, I did find it easier 12 months ago to walk 5 kilometers and back. 12 months ago, maybe I didn't need to have a little sit down, and then this year, actually, I do. Or when I was ordering a coffee last year, it was easier for me, it was less stressful for me than it has been this year. And these aspects of MS, you wouldn't say, oh, I had a relapse and after that point it was all different. You say, yeah, I mean, I didn't have a relapse and I'm on therapy and everything's fine. However, I would say that things are maybe progressing without relapses.
So this brought us to the concept that we have a relapse-associated worsening and something we call PIRA, as progression independent of relapse activity. Can you define both concepts a little bit more?
Yeah, so classically, if you open a textbook and you look at MS, you'll see the relapsing remitting MS as a stepwise worsening. So you come from this level where you're doing quite well and you've not had a diagnosis, and then you get blurred vision because you have this inflammation of the visual nerve. And then that gets a bit better because you go to the doctor and you get cortisone, but maybe it's never quite as good as it was. And over time, with each relapse, this point where the patients come back to is never quite where it was at the very beginning. And this worsening associated with relapses would be the classical accumulation of disability that you see in a classical textbook, relapsing remitting MS. Progressive MS would be when patients never describe, on that day in 2024, I started seeing blurry. Rather, they say, yeah, I don't know, 12 months ago, I could walk 5 kilometers and now it's 3. And then next year, you see them again and it's 2, but no relapses. And that would be your classical progressive MS.
But I feel that, let's say, all these strategies of immunomodulation resulted in a significant reduction of annualized relapse rate in our patients. And this is maybe also a reason how we were able to unmask this slow progression. So I think it's a success in a way to be able now to detect progression. Which brings me to the question that monitoring monitoring of therapies is an important issue. Are there strategies to somehow define this disease progression?
Yeah, so that's a huge part of our research in Düsseldorf with Lars Mastenak and Mark Pawlicki. So they are in developing strategies how you can test for nerve damage in blood. And they do a lot of patient cohort analysis of blood, looking at GFAP and NFL, which are 2 markers of nerve damage. And Lars is a big digital medicine guy, so he's got smartwatches on big patient cohorts, and also apps on your phone where you can type, and it measures how fast you type and how well you type, and also how many steps, your heart rate, and how challenging then daily activities are for you. And these are really excellent monitoring strategies for progression in MS, because then we can say we have data from your case 2024 and 2025, and you're typing 0.5 milliseconds slower per second. You know, there's obviously an element here of worsening that you as a patient cannot be aware of because it's too finite. And we're doing a lot of research in that area, and there's a lot of good therapeutic strategies there being developed, how we can measure that quite very exactly.
Yeah. However, I think there will not be patients where we only see relapse-associated worsening, while others only show smoldering disease or slow progression. So these two pathophysiological aspects are somehow intermingled in the same patients, right?
Yeah.
So is this classical way to look or to regard MS as a relapsing remitting versus secondary progressive or primary progressive disease still a valid concept, or is it changing?
Yeah. So it's becoming a very grey area. New school MS research, our current data, show that actually patients have a mix of both. Patients with classically relapsing MS also have progression. And some patients who primarily have a progressive MS do describe relapses. So we kind of have more of a descriptive way of labeling MS and less of this clear-cut relapsing progressive, rather than maybe we'd say progressive with occasional relapses, or active progressive, or we'd say relapsing remitting, and would say, you know, in the clinic we talk to patients about their aspects of progression independent of the relapses. So it's really important that we ask patients about every aspect of their MS, not, hi, how are you, any relapses, no, great, see you next year, rather...
Saves time.
Yeah.
That's maybe not the way.
It's not the way. You have to ask, you know, how is it ordering a coffee this year compared to last year? Is it harder? Because otherwise you'll miss, in patients who are progressing, independently of relapses, this progressive aspect.
Thank you.